October. It's the time of the year where the world unites and come together to promote and stress the importance of breast cancer awareness. As of 2020, breast cancer is the #1 cancer in women and the leading cancer overall in the world, as reported by the World Health Organization. As in any disease, early detection is always the key to an excellent prognostic outcome, and breast cancer has signs and symptoms that are visible and noticeable. Hence, our campaign is Early Detection Saves Lives. What is breast cancer awareness, or what is breast awareness? So generally, awareness means having an ongoing knowledge of something, and that something is your body, in particular, your own breast. Getting to know and becoming familiar with their appearance to learn how you feel your breasts at different times, before, during, and after menstruation, as you grow older and as you have children. Men also needs to be aware of their own breasts and any changes over time. If you are aware of your breasts and you know what is normal for you, then you will be able to notice any irregular or abnormal changes. So let's start by knowing about yourself, knowing your body, being comfortable your body, and accepting your body. So these are the 3 things that we need to keep in mind when we check our breasts. Before menopause, the breast may feel different around and during your monthly period. The breast, it can become more sensitive. It feels tender, heavy, and lumpy, particularly before a period starts, because the milk-producing part of the breast becomes active. It is also common to have one breast larger than the other or a different shape and different symmetry. After menopause, after each reach the age of your period when it stops, the breast may feel soft, less firm, and lumpy. This is because the activity in the milk-producing part of your breast has stopped. You also need to check yourself during pregnancy and breastfeeding. During this time, it's still important to be aware of your breasts. They may become larger, lumpy, and tender due to the pregnancy changes. Take special notice of any breast changes not related to your pregnancy, like hard lumps and abnormal nipple discharge, yellowish, white, especially if it's red. So any of these changes during your pregnancy that you don't think is normal, then you have to report to your physician. We also have to do a regular self-breast exam. Now, our self-breast exam, it is advisable to start as early as 20 years of age. And the best time to do a self-breast examination is when your breast is not tender or swollen. This is usually on the 10th day after the first day of your period. For postmenopausal women and those who had a hysterectomy, they can pick any day of the month to choose when to do a breast examination, and you keep it as an appointment date or a routine every month that you mark on your calendar. There is no right and wrong way of checking your breasts. You can do this in front of the mirror while you're getting dressed or while you are in the bath taking a shower. These steps may help you in your self-breast examination. We have the look and feel technique, and we use this technique for both men and women. So in the shower, using your hands with soap, you glide your fingertips around your breast using the pads of your fingers at the center and going around outside of your entire breast. Feel for any mass or any abnormal changes. In front of a mirror, you stand in the mirror with your arms on your waist and you check for skin changes, for asymmetry, and for the size of the breast. Lying down is another way to be checking your breast. Now, this technique is better used for ladies who are well endowed because it's easier to feel the different areas of their breast at this position. So this is the same technique. You glide your hands around your breast to the center, going outside, and then towards the end of the edges of your breast, especially here near the axilla. These are the palpation techniques. So you can go up and down, you can go around. It doesn't matter as long as you feel each side of your breast, looking and feeling for any abnormal changes. As I've said, there's no right or wrong way of doing it. For men, we also use the look and feel technique. Usually abnormal changes for men, it comes with age. So the older they get, sometimes they will notice something that shouldn't be there. So they can always do an examination, a self-breast examination, but they can always go to their physician if they're not so sure. Now, what are the changes do we have to look out for? So these are the photos, these are pictures depicting the abnormal changes that we have to look out for. Sometimes what is abnormal is normal to you. That's what I said, that you have to learn about yourself. For example, a change in size or shape of the breast. As I've said before, some ladies would have a bigger breast on the right than on the left. Their breast is normally not symmetrical or not the same shape. But if you know from the beginning that your breast has always been symmetrical or the same shape, then any variance or any difference in the size you will notice. Redness or rash on the skin and around the nipple. Now, skin allergy can also happen around the skin of the breast. So this might be skin changes, or redness or rashes can be a skin allergy or something else. Usually, if you are not so sure, then just better to see your physician. Nipple discharge. Now, nipple discharge sometimes is hormone related, or when you're pregnant, you get some nipple discharge that comes out that are milky and white. And sometimes if you have an infection in the breast, nipple discharge will become yellowish or thick white. What we're looking mostly as a sign of breast cancer for nipple discharge is a bloody discharge that is not related to any trauma. Swelling in your armpit or around your collarbone. Our armpit houses some what we call lymph nodes that protects our body from infections, virus, and bacteria. They're the first line of defense also inside our body. So whenever we have infection, colds, flu, things like that, some of our lymph nodes under the arm become swollen. So we have to make sure if this swelling is related to an ongoing infection or is it related to something else. And now that we're having the COVID vaccine, most of the ladies or most people who have the vaccine, they notice that immediately or after a few weeks, they feel something palpable under their armpit. So these changes can be related to the vaccine as well. But if this swelling in the armpit is something that concerns you, hard, non-movable mass, then yes, this is something abnormal that we need to have someone check out for you. The most common abnormality in the breast that most women are concerned about is lump or mass. So the mass, usually with younger ladies, okay, or even ladies in their 40s, it's common, or ladies who are not yet menopause, it is common to have what you call a breast cyst. These are hormone related, and this is one of the things that makes our breast feels normal or abnormal. So the cyst can happen before or after your period, and it feels like a mass, but it's bouncy and it moves around like a balloon. Some of the mass may not be bouncy, and they may be a little hard, but they are smooth and round. And these are called benign breast masses, like fibroadenomas, and they are usually not harmful. The breast masses or lumps that we are looking out for that can be a sign of breast cancer is a mass or a lump that feels rough to the touch. It's like you're feeling a rock, a small rock. It feels rough, the texture is rough and uneven, and it doesn't move at all. So that is a signal that this is something that needs to be checked out. Skin changes, again, like the one that we said with the rashes. Now, if you have seen an orange, the skin of an orange or the skin of a lemon, so the skin feels rough and the pores are quite big. So if the breast the skin around the breast develops this kind of skin texture, then that is something that, again, we need to check out with your physician. Now, some ladies from the very beginning have inverted nipple. This is already normal for them. But if it's not normal for you, that you notice that your nipple has become retracted or inverted and you feel a mass underneath it, yes, that is something, again, that is abnormal and needs to be checked out. Now, for ladies, during the period before or after, sorry about that. Now, constant pain in your breast. This is something that happens during your period or before your period or after your period. So we need to make sure that this pain is related to these hormonal changes, or this is something different or new for you. If you have any of these abnormal changes, then you have to consult with your physician, and we can do some investigation to see if this is something that we need to further investigate or further observe. You can always go to your physician for a more professional physical breast examination as well, if you're not comfortable of doing it yourself. The signs of breast cancer in men is similar to the ladies. So similar signs and symptoms, similar way of detecting. And again, it happens most of the time with older men. Breast cancer in men develops like 1 in 1,000, less than 1% actually of the total number of ladies diagnosed with cancer. But if any changes happens and they're not comfortable, again, a professional breast examination will have to be uh, must done. So know your risk factors. Is another way to help is knowing what your risk factors are or medical history. Now, breast cancer is most common in women, in the female. So being a female puts us a little bit more at risk compared to men. Used to be in the old days, breast cancer, they call it the disease of older women, but not so now. We have ladies who comes and they're diagnosed with breast cancer earlier than 50s or earlier than 60s. So while we grow older also, it's put us at risk. So previous history of breast cancer or any cancer also put us a little bit at risk, especially if this person has received a radiation to the chest or radiotherapy to the chest. Family history of breast cancer or any cancer. Now, there's only like 5% to 10% genetic related breast cancer. And what we're looking for here is a BRCA1 or a BRCA gene mutation. So if you know that you have a family history of breast cancer, you just need to be vigilant. And you need to do your breast examination or your routine mammogram every year. And once a year, you have to see your physician for a professional breast examination. Benign breast masses, they are common with the younger women, like fibroadenoma and breast cysts and fibrocystic changes. Most of the time, these are harmless, and this can be observed over time. They also say that early puberty or early menstruation can be a cause, or not breastfeeding or has stopped breastfeeding for a long term. Not having children or late childbearing, current use of hormone replacement therapy, it can be a factor. Obesity, but obesity and chronic smoking, they say it can be a risk factor for breast cancer, but it's not only for breast cancer. It can be for any other diseases or cancer. So we must have to keep an eye with our weight management and try to stop or lessen our smoking, because it's not only breast cancer, it's detrimental for our health, not to be too obese or not to smoke too much. Now, breast imaging, what are the ways that we investigate any breast abnormality? So mammogram, in Johns Hopkins Aramco Healthcare, we start screening mammogram from the age of 40. And mammogram is still the best way and the best tool to detect early breast changes. So if there's anything that has started to change inside the breast, mammogram can see it, because sometimes early breast cancer cannot be visible to the eye, or it cannot be felt. Um, it's something that can only be seen in the mammogram, in the X-ray, in the imaging. So we still stress the importance of doing a regular or a routine mammogram every year. Breast ultrasound, this is ideal for ladies who are less than 40 years of age, and this is what we use for them. And sometimes older ladies, or those who have started screening mammograms, sometimes we call them back for more imaging using ultrasounds. This is just to double check what was seen in the mammogram. Now, breast MRI is recommended for patients or for um, ladies who have high risk of breast cancer. And this is as per discretion of the radiologist or of your physician. It's a very sensitive test, so it's we have to identify patients who really needs a breast MRI. So to summarize, we need to do our self-breast exam from the age of 20. Ladies who are from 40 years of age should start their screening mammogram. We have to do a regular clinical breast exam. This is from our physician, once a year or twice a year, with your general physical health examination. Be aware of your risk factors and be healthy in yourself. Nutrition wise, we have to eat a well balanced diet. We have to do a regular or routine physical exercises, maintain a healthy weight, and quit smoking if possible. Now, this is not just for breast cancer, but for our overall health as well. Thank you so much for listening, and have a good day.